There are certain procedures that we perform in plastic surgery where I know that the result is going to make a tremendous change in that patient. And one of them is otoplasty, or ear pinning. These are patients who have ears that are a little bit more prominent. And it's a psychologically devastating thing for a lot of patients. They may go through their lives in their teenage years, sometimes even earlier in their lives, and have ears that stick out too much that they get teased about, they may feel uncomfortable with, and it's not something that's easy to hide, especially with boys. Girls a lot of times can hide that in long, they may grow their hair long and therefore they can cover their ears that might be a little bit prominent. For boys, it's a very difficult thing to do. And that's where we come in as plastic surgeons. To me, otoplasty has really two components in most cases. Sometimes it's one or the other, but in most cases it's a combination of two things. The ear cups out from the side of the head too far, meaning that it's too cupping. Or you can have the flailing of the upper part of the ear, where the upper part of the ear has very little definition, where the ear doesn't fold back like a patient might want. In this case, sometimes we see one or the other, but in most cases we see a combination of both. What's interesting is that this is all about manipulating cartilage. The ear is just a big cartilage and it's shaped in a very particular way for that patient, determined by that patient's genetics. But we can come in and actually do something to change that. And that's what we do in otoplasty. I can diminish the amount of cupping, make it stick out less from the side of the head, and I can also bend the upper part of the ear by changing the configuration of that cartilage and bend that part of the ear back so that now it's not only not cupping as much, but now it's also flipping back and being closer to the back of the head, so it becomes very, very pinned up against the side of the head. Now, most people think, oh, how do you do that? It's unbelievable. It must be very painful, difficult to do. And the answer is that technically the surgery is it takes a lot of technical skill to do that type of surgery. But what's good for you as a patient is that it's something that we can do in an office setting in most cases, under local anesthesia. Patients don't need to go under general anesthesia. The only time I do this surgery under general anesthesia is if it's a patient who is really young, maybe a teenager, 12, 13 years old, and can't undergo something under local anesthesia. But adults in their late teens or early 20s, when we typically do this type of surgery, we do it right in the office, right under local anesthesia. And it usually takes me about an hour and a half to 2 hours to do it. And the results are pretty much immediate. I usually show them a photograph right after I'm done. They sit up on the OR table, they'll see their befores and they'll see their after immediately. And it's almost like a tear-jerking moment for all of us because that patient is suddenly in a different world. They cannot believe how different they look. So otoplasty is a very powerful procedure, and the best part about it is that we can do it under local anesthesia in most cases. Otoplasty, like I said, is one of those procedures that can transform a life within minutes. A lot of times I will see young boys, teenage boys who come in 14, 15, 16 years old, and the stories that I'll typically get from mom is that their son is very introverted. He doesn't interact with other people. He comes home from school and he just goes into his room and does his thing and he doesn't want to be bothered. And she's convinced that it's the ear. And when you talk to the child, usually you realize that yes, it's the ear. He's very upset about having ears that's sticking out too much. He's getting teased. He doesn't want to be seen with his friends. He's the one that gets his ear flicked. In my own practice, I have seen that completely turn 180 degrees after the surgery. In my own eyes, I've had patients where we've done the surgery to come in for their follow-up, even their first follow-up, and you can see the light in their eyes light up. And now they're different. They come in, have a little bit more of an attitude, they have a little bit more confidence. Instead of looking down, now they're looking up. It's one of the most amazing transformational surgeries I think that we certainly perform in our practice.